Mm.
Good evening, everyone. My name is Asher Kemp Jr., and I'd like to welcome you to our tonight's town hall. And I'd also like to thank our guests for being a part of this town hall, promoting an environment of resiliency for parents during COVID-19. I'd also like to thank the Coalition for putting this event together. The Coalition is a group of mental health and human service agencies that was established about 6 years ago. They came together to create partnerships, facilitate sustainable models of cultural competency, policy, practice, programs, and services for communities of color. So welcome and thank you for joining us tonight. I'm now going to turn it over to our chair of the coalition, LaJewel Harrison.
Good evening, everyone. Thanks for joining us this evening. Thanks for all of these panelists joining us and volunteering their time, and thanks for everyone else logging on and spending their evening with us tonight. I'd like to start by acknowledging our board members. So CCCP membership consists of West Health Systems, Marikey, Dunbar Community Mental Health Agency Consortium, Community Council, Akana, A.L. Colley Associates, the Black Brain Campaign, Safe Meadows, Dr. Alton, One Day at a Time, and Widener University. So thanks to all the members for just their commitment to what we do in the community. As we get started, you can see that we have a great number of panelists here tonight. And so I just want to jump right in and introduce you to them tonight. So I'll start by introducing you to Dr. Jamie Banks. And when I say, you guys can wave so everyone knows who you are. Dr. Jamie Banks is currently the Director of Trauma-Informed School Practices at the School District of Philadelphia. In this position, Dr. Banks oversees the Office of Prevention and Intervention, where she has been working to further the district's implementation of trauma-informed practices and continuum of mental health, mental and behavioral health supports. Welcome, Dr. Banks. Next, we have Dr. Booker. Dr. Booker is the CEO of Global Leadership Academy. Dr. Booker has 3 daughters, 1 granddaughter, 1 grandson, and 1 son-in-law. She is a graduate of Spelman College, where all of her daughters graduated, Antioch University, Nova Southern University, and received her principal certificate from Temple University. She's an active member of AKA sorority. Dr. Booker has dedicated her life to preparing future leaders of the world. Welcome, Dr. Booker. Next on our panel is Hanaya Sharp-Brown. She's the Director of Government Relations at the school district. Hanaya currently works as the Director of Advocacy and External Engagement at the School District of Philadelphia, where she is responsible for advising the superintendent and district cabinet members on legislation being considered by local, state, and federal government officials.
Hania.
Welcome, Hania. Yes, I will say your name correctly, hon. Next, we have up Jill Doherty, Dr. Doherty. Jill Doherty is the head of school at Stratford Friends in Newtown Square. Stratford Friends is a co-educational Quaker independent school for students in grades K through 9 with language-based learning differences. The school focuses on the unique gifts and needs of each student to foster strong, independent learners. As a school leader and a reading specialist, and as a parent of high school, sophomore, and college freshmen, Ms. Doherty has always advocated for unique learners and has championed their success in the classroom. Welcome. Our next group are our medical doctors. We'll start by introducing Dr. Elena McDonald. Dr. McDonald is a board-certified general pediatrician who has been practicing in the Philadelphia area for the last 20 years. She is the owner and chief medical officer of Memphis Street Pediatrics, Pizzica Pediatrics, and Castor Pediatrics. Yes, 3 offices. She is also the medical advisor to the nurses of several charter schools in the area. Welcome, Dr. McDonald. We also have Dr. Kelly White. Dr. White is a pediatrician, and she attended Dartmouth College and Harvard Medical School and has worked at the community health centers in rural New Hampshire and urban Philadelphia for over 40 years. Welcome, Dr. White. And our last group that we have included are our mental health providers. We wanted to make sure we had panelists on to provide mental health support. And so we have Dr. Gooden. Dr. Gooden is the president of the Delaware Valley Association of Black Psychologists, which is a chapter of the Association of Black Psychologists. She has a private practice in Westchester, serving teens and adults. She is the author of A Single Bracket Does Not Jingle. A Single Bracelet Does Not Jingle, Finding Your Ideal Love Partner, Making Love Last and Ending Unhealthy Relationships, a multiracial examination of love relationships. She is the host of Don't Get It Twisted on Hot101.net live on Facebook every Wednesday from 3 to 5. Next, we have up Dr. Kemp. Dr. Kemp is a licensed clinical psychologist and certified school psychologist working full-time for the school district of Montgomery County. She's also running her own private practice in Delaware County where she treats adolescents and adults. Welcome, Dr. Kemp. Waving next will be our Dr. Lee. Dr. Daniel Lee is a licensed psychologist and certified life coach with over 15 years in the field. He is currently serving as the Deputy Superintendent of Equity for the California Department of Education. Thanks for joining us tonight, Dr. Lee. And we have Jeffrey Marchese. Am I saying your last name correctly?
It's Marquesi.
Marquesi.
Thank you.
The next guest was going to be way off. Coordinator of Student Assistant Programming Services at Mars Outpatient Addiction Counselor Services, specializing in adolescent and family services. So thank you all for joining us tonight, and we can jump right in and get started. Okay, so the parents, we figured we needed this tonight. The parents are pretty much stressing out. We have the coronavirus, we have civil unrest, we have schools closing around us, and parents are in need of you guys' assistance. So please just jump right in and answer questions where you see the need. So the first question up, so I'll read some questions that we provided ahead of time, but I will also be taking questions from our viewers. Okay, so the first question up, the coronavirus is not reportedly having a huge impact on the physical health of children, but how do we see it affecting the mental health of our youth?
I can start. And good evening and nice to see you again, LaJoel. Can you hear me? Okay. I would say, one of the things I'm really challenging folks to understand is we need to think about the idea that it does affect a small group of children. And pretty much what research is talking about, and the medical doctors probably can say more about this, is that, we shouldn't take it for granted that children can get it, and there's cases around the country where children are getting affected and it's affecting sort of school operations. The one thing we have been talking about more, I think longer, is the idea of the anxiety that's associated with this pandemic and how, and it's not just the coping with an illness, is coping with the consequences of having a pandemic. Once they lifted that moratorium on, sort of foreclosures and, being evictions, it's a lot more stress on children, I think, and they're experiencing that more. So, the one thing I really want educators and parents to understand is let the system know what stressors you're under so that your school can, prepare some support for you, whatever they can do. Because until we can get people past sort of that, kind of that reptilian fight, flight response, it's going to be hard to get students engaged in everyday learning. And then you have the challenge of learning, doing it distantly for some folks. And that's a new skill set in and of itself.
So are you calling on us one at a time, or you just want us to just chime in?
You can jump right in, Dr. Booker.
Okay, so I have 1,300 students under my care, and throughout this pandemic, what we need to recognize also is everything has changed for them. They are used to the routine of going to school. They are used to the routine of having dinner with their family or being with their family, but now they are 24-hour roommates with their parents. The stress that they are going under and the anxiety is very high. Along with all of that is that my children, one of the schools is on 52nd Street at 52nd and Pine. And so my scholars also saw tanks and soldiers and all of that during this time that they were out. So there's a lot of fear of coming back. So as a school, what we're trying to do and what parents need to do is to help them to begin to cope as much as possible, but allow their feelings to come out and have conversations. And we're really concerned about them coming back. We've got a lot of things going on to stay in touch with them, but do recognize that these young people, everything about them is totally different, totally different. And we all live around routines, and that's very different for them.
I can add something to that, just to echo my two colleagues that just spoke. Definitely a lot of increased anxiety. Students being fearful for their safety, students having anxiety about returning to school, but on the virtual platform. They're feeling distressed that they're not going to be able to see their friends and their teachers the way they would normally see them, that they're not going to be able to participate in sports or field trips or school-related activities the way they used to. And then just being bombarded with what they might hear or see on TV, just that fear of getting sick or of one of their parents getting sick. So what I've spoken to a lot of my colleagues about in the school district is that as teachers, as parents, as professionals, we have to be able to have that open dialogue, just like Dr. Booker said, with students, and not shy away from answering their questions, but balancing what's appropriate information, not wanting to feed their anxiety, but give them enough truthful information so that they feel satisfied, but just kind of balancing that, making it age appropriate, because there is a lot of information out there, and we have to be very mindful of how we go about sharing that information to decrease anxiety, give them a sense of normalcy in a very abnormal situation right now. And the best way to do that is to have that open dialogue, answer those questions, and try to make their routine as normal as possible.
We've also been working on working with our staff to learn how to pick up a student or identify a student that might have difficulties. In the building, that's easier said than done. We're talking about virtual now. So what are the look-fors? Then what do you do once you see look-fors? Who do you communicate that to? How do you come up with interventions and supports? And so that's what we've also in this Philadelphia School District been working with our teachers and teams on building that out more, because it's easier said than done when you're in Zoom calls or kids are not showing themselves on camera. You have to do a little more digging to identify those students.
I agree with what everyone said prior to me, especially with Dr. Banks, trying to identify our children who are struggling with this. Because for me as a pediatrician, oftentimes it doesn't come in as, I think my child is depressed, or I think my child has anxiety. Oftentimes it comes in as his sleep pattern is completely off outside of playing the video games all night and sleeping late. All of a sudden he's lost his appetite, or the kid who was usually really chatty is now keep it to himself, or, he's angry all the time. And then those are we want the parents to start to pick up on that, as well as, again, it's a little bit more difficult for the teachers when it's virtual, but children, we want parents to know how to recognize just a difference in their child. You may not know why they're having the difference, but enough to reach out and say, hey, something's going on with my child. Can I talk to you about it? Or maybe they have headaches all the time now, or they have stomach aches. So it presents in multiple ways.
Thank you for that. As I go on with questions, just want to remind you guys that you can just jump right in with the answers. Dr. Gooden, did I cut you off?
Yes, if I could just say a couple of things. One of the things that we're going to see an increase in is, of course, trauma, and our children reacting to the traumas that parents are having, losing jobs, losing homes. They're going to be increased things that are occurring within the home and around the home that will stress the child out. And many times children don't know how to express what's bothering them. So we have to be that much more aware that whether it's things going on in the news, whether it's the fact that our parents are losing jobs or having to work increased hours, and increased hours if they're those people who are considered essential workers, who are also fearful of coming back home and perhaps bringing the virus back to their family when there's no space for them to isolate themselves.
Thank you for that. So we speak of, having to stay home and do the on computer schooling, the virtual schooling. So what about the schools that are currently open? And there are some county schools open and there are private schools that are doing in-person learning, and the public schools are looking forward to doing in-person learning in the near future. So what should the parents start to consider when thinking about whether or not they will send their kid back to school to do in-person learning?
But Jewel, some of the things that we've been, and hello everyone, it's so nice to be here. Some of the things that we've been sharing with our families, we're starting in person on September 8th, so we're starting soon. We've really been talking with families and kids about practicing wearing a mask, really practicing hygiene, and really being thoughtful about it, and having kind of those things in place where it feels more natural. So the first time they start using these things that are put in place to help keep them safe in school and keep transmission low, it doesn't feel so scary and intrusive. They're not so conscious of the fact that there's something on their face, or that just kind of hand washing is something that is just second nature and you're just doing it more. One thing we're working with kids is creating secret hand washes, like, you know, the old secret handshake. So something that lasts for 20 seconds and different ways to wiggle your fingers around and different things you can do. Things that really help them have fun with being safe and having safe practices and not. Some other things we're really encouraging our families to do is talk with your pediatrician, make sure that this is a good choice for your child to be in person. Make sure that your child knows that the teacher behind that mask is there because they care about them and they're excited to have them back in school and they're excited. And also really making sure all of our kids have language for things when things aren't going well. Being able to say, I'm feeling nervous, I'm feeling worried, give voice to those things that can get in the way of learning. I need a break, all of those kinds of things. So instead of just kind of sitting there and struggling in silence, we want them to put voice to what is hard so that it can be addressed early and really help them work through that.
I serve as the medical director for Frankie's World, which is a medical daycare on Poplar Street towards North Philadelphia. And we have been open with the exception of a few weeks during the pandemic. And we have a capacity of about 40 to 50 children. Right now we have about 22. Our children are among the more medically challenged. We can have children who have issues such as diabetes, but even as medically involved as children who have tracheostomies and require ventilator care. So this has been a pretty challenging place to find oneself during the pandemic, and our staff has been absolutely phenomenal about hygiene. Our youngest children are 6 weeks of age, our oldest are 12. You can imagine that I was very worried as we headed into this phase, but many of the families whose children come to us are essential workers. And it's worked reasonably well. On the other hand, I have a 3-year-old granddaughter who goes to a preschool here in Germantown, and that has been interesting as well. They had a class size of 5, and all the 3-year-olds are very interested in germs. They're very interested in each other's masks. It's quite charming that when I talk to her, she can always tell me that this girl had ladybugs on her mask and this boy had stars. So it's become an acceptable thing for them. But it sort of interests me, they're also very interested in policemen. I guess that preschoolers are always interested in policemen, but that's the anxiety that I'm hearing course through her life right now.
So I think that parents need to check the environment and make sure that it is a safe place to send your child back to school. It is, first of all, that it should not be that they're going to go back to the same old situation, because things are different now. And parents need to recognize that things are going to be different. I sent a survey out to our parents, and about 35% of our parents said that the children themselves did not want to come back to school, that they were afraid to come back to school and didn't want to come back until this pandemic is absolutely gone. So you have to recognize the fears of those children that don't want to come back. And so for us, we're going to be out virtual until January, and then start a hybrid model so that we can address those children that want to stay home and not. The other thing is that in dealing with our parents who are sending their children into the schoolhouse, that they also are going to be active members of whatever is going on in terms of mask, in terms of you know, I don't know how you can expect the kindergarten child to wear a mask all day long, to stand on a spot because they can't be around other children. I mean, I think the anxiety in school is going to build on the other part of the anxiety. So it's very difficult thing to deal with and what's to happen now. But for our parents, we as the educators and the medical doctors, we've got to help them and encourage them, whatever way they decide to go, give them the chance to also meet and talk with us.
If I could just add to that, speaking as a parent myself, as well as a psychologist, there is no perfect solution. You know, I feel like there's pros and cons on both sides, whether they go in person or whether they do the online schooling. And I think every parent has to know their child, know the school setting, and decide what's best for their individual child and their family. And from sitting in on dozens of meetings and reading all these emails from my children's school, as well as the school where I work, a lot of this comes down to schools needing to increase sanitization of the high touch areas, making sure that they're doing both social distancing and requiring that masks are worn. And that they're really putting, strategies and protocols in place for staff and students regarding, knowing when people need to be quarantined, when people need to stay home, when people need to switch to online learning, when there's been any type of exposure. There is a lot that goes into this, and I think it's a heavy decision. And to Dr. Booker's point, you really have to look at it from different angles and involve not only educators, but your children's physician as well, and make the best choice for your family.
If I could piggyback on Dr. Kemp and Dr. Booker, I'm sorry, but as a pediatrician, what I find is oftentimes the children will follow their parents. So you have to get the parents comfortable with the situation in the school. And the parents, everybody has to be all in, because to Dr. Kim's point, there is no perfect solution here. And at the end of the day, what you expect is for your school to present the safest options for your child. And then ultimately, you as a parent have to make the decision of what to do with your child. And there's really no right or wrong decision here. It's just the decision that you make for your family, because we're in unprecedented times and it's very stressful worrying about, am I making the right decision? So you have to make the best decision for your family with all of the information that's presented to you. And also we have to be all in. So if you're going to send your child, if you agree to send your child into a hybrid environment, if your child is sick, don't send them to school. Keep them home. Call your doctor, call your physician. We're expecting the calls. We know that they're going to come. But, a lot of times in the past, I just gave them some Tylenol, sent them off to school. Those days really are gone. Everybody has to be all in on this.
Thank you. That was a very comforting statement about, there's no wrong decision. That it takes the weight off of you as a parent to hear that, Dr. McDonald. Dr. Lee, before you go, I just want to have you chime in here as we talk about children entering back into schools. What psychological considerations should we have in order to keep them at peace?
I think it's two things that popped on mind in terms of just psychological, but also resources. I think number one, it's similar to what Dr. McDonald was talking about, just like you're talking about sort of being mindful of their physical health and rushing them into situations. We need to be mindful of their mental health too. And I think that has to be just as prominent during this time. And I think the other piece, is really looking at, from an equity perspective, resources, and I think parents, I would say more than ever, need to really be reaching out to their school systems and talk about what do they need to help their child and themselves be successful. So it's like, whether it's consultation with a teacher about developing a learning space at home, how should I, learn how to use the portal so I can support my child in accessing information? Do you even know how to log into the system or use Zoom or Google Classrooms or whatever the platform that your school is using? Because I think at this point, part of it is access and equity are going hand in hand now. It's like, and then what resources do you need if you can't create that opportunity? Because everybody's concerned that the folks who have resources, they'll find a way to weather the storm. It's the ones that we need to be concerned about, the ones that don't have the resources. And those are usually the ones that we can wrap ourselves around if they're physically in school. And I think we have to realize we have to come up with strategies through this virtual platform around reaching our, arms around the folks and the children that we normally wouldn't see and we won't see until we get back into this higher, in-person instructional model. So thank you for having me, and I appreciate the time.
Thank you. Dr. Booker, would you like to mention anything before you have to exit also? You're on mute.
I think I'm okay for a few more minutes. And so I'll kind of hang around and I'll let you know when I got to step off. I kind of have two computers working. So that one's kind of looking at that.
Perfect, perfect. Okay, so as we are doing a virtual learning, what options do parents have now, specific to Philadelphia, for childcare options?
That is a tough one. I'm sorry,
Yeah,
go ahead.
I was just going to say, I know specifically with the school district of Philadelphia, we just are working very closely with the city on what that will look like, what that support looks like for our families. Because unfortunately, it's not something from a district perspective that we necessarily can provide. And so the city has been a huge partner in trying to identify childcare spaces. They just announced the access centers where kids can go who don't have access to Wi-Fi and learning and stuff like that. So the city's been a real critical partner in that for us with the school district.
Where can people go to get the list of access centers?
I will put the link right now into the chat.
Thank you.
You're welcome.
And I just want to reiterate, everyone listening, you can put your questions in the chat, or you can put your questions in the Q&A section of the Zoom. Go ahead, Dr. Banks, sorry.
To build off of that, also working with the city, our partners, we're looking at what mental health services can we help provide in those access centers. So everyone's trying to wrap around to know that that support will be needed, and we're all trying to figure out how to make that happen.
I'm also one of our parents, and I would like to also offer for parents to think of each other. If there's no time that we need to think about community, it's now. And perhaps there can be with each other, if someone is on the block who is a person who stays home, and there are other people that have to go to work, that maybe they take those children in while the parent is at work and work together. Because all these childcare places are not going to be open for all of the children that are going to be in need. And we're going to have to figure out how we can work together as a community. And our children play together on the blocks or, streets or whatever. I'm sure we can try to figure out how to learn it. And this came from one of our parents, and my family life coordinator is also trying to get churches to take 5 to 10 children as well. But it's a problem, the daycare, and that parents are going to need.
I just wanted to say that Frankie's World does have the ability to take on a few more children, and we would like to do that. So we are prepared to have children come to us who have a variety of medical problems, who may be doing well within the school district under normal circumstances, but they can reach out to us at this time. And just a little mention, however, one of the things that we've lost at Frankie's World, and that my patients have lost in other places, is the ability to access some of our special services. we would normally have speech therapy, physical therapy, occupational therapy coming to the building at Frankie's World, and my parents would have had these individuals coming to their homes. And unfortunately, Frankie's World made a difficult decision to decide to stop visitors to the facility because of the risk that they would pose for the children there. And similarly, many of the families who were used to having these services no longer had in-person services. So they now would have an 18-month-old and they'd be trying to do speech therapy with their child and the therapist through Zoom. It just was not going well.
I just want to add, Dr. White, when you mentioned Frankie's World, that is a younger child care nursery level school.
It actually can take children up to age 12. So
oh, wow.
In addition to having children who spend all day there, we have quite a number of students who come for an after-school program ordinarily, but they could come throughout the day at this time. And some of those students are also with us on a sort of summer camp basis. So it's worth looking into us. We're not huge. We certainly are not going to solve the difficulty for more than a handful of families, but we can be of support.
I asked because one of our viewers asked a question about making sure the question and answers are relevant to that nursery level care, and your answers are there. Thank you.
And to Dr. White's point, there are so many services that are lost when you go to the virtual learning model. You know, in addition to the physical therapy, the occupational therapy, the speech therapy, but children who have academic challenges, children who have IEPs, and children, you know, with special education, you know, a lot of those in-person interactions are lost, and these children start to fall through the cracks. I always say it's easy for a child to sit in the back of the classroom and fall through the cracks. It's much easier to fall through the cracks on a Zoom.
Mm-hmm. Thank you. So here's a very specific. Go ahead, Dr. Kim.
Can I add to that last comment?
Certainly, certainly.
So working in special education, certainly for the students that have IEPs, in the state of Pennsylvania, we are still mandated to give them the services that are in their IEPs. So with that being said, all of the evaluations that need to take place, whether it be by the psychologist, the speech therapist, the OT, the PT, those are all going to still take place in person with whatever precautions we need to take. And then in terms of providing those services, the services that can be provided remotely will certainly be provided remotely. And that's mainly speech. I know our OTs and PTs are trying to figure out how to manage their caseloads with this virtual learning. I don't know if they're going to have a schedule where certain days out of the week, the individual students are coming into the building to get their services. But certainly we are still held to having to give the students their services. Being in a virtual world does not alleviate us of giving them the services that they're entitled to.
And can I add that the way that I have 10 special education teachers and 1 director, and when this began, they contacted each parent. They all know what's in the IEP and how many hours their children are supposed to read, receive, and they set up schedules so that they could do what they could do online. Then we wrote letters to all of the speech therapy companies, as well as any children that APS schools, and said and required them to continue doing that service, whether it was online or in person, however they were going to do it to be safe. But it's a court requirement. You can't just say that because we're closed that they don't get that service. And then you have to monitor it. So then we had to come back and make sure it was monitored by my director to make sure that our young people were doing, you know, getting taken care of.
Thank you. Jill, would you like to add some strategies parents can use to assist if they have children at home with learning disabilities?
Absolutely. I think some of the things that are really important is helping your students. Many kids with learning disabilities struggle with executive function, keeping themselves organized and having a really good system for being organized, getting some help learning how to do things like bookmark sites that they need to use on the computer. I had to have my 18-year-old teach me how to do it, but once I learned it, I had that skill. Having a structure posted for your kids. One of my parents went and took a bunch of photographs that were in frames in their house, took that out and put the daily schedules and the things they needed and put them right in there. So you're not having to run out and buy whiteboards to put stuff up, but as soon as that computer's up, that schedule's right there and it doesn't get lost and shuffled under the pile of papers. Really making sure that your teacher understands what your child can do, not what you can do. It's so difficult to watch your child struggle with something that you want them to be able to do. And it's so easy to step in and say, let me show you fractions, my friend. We're gonna get through this page really quick. Your teacher needs to know what they can and cannot do. And they can no longer sit over their shoulder and see that. So really, really hold back that urge to overhelp. And when they're struggling, document that for your teacher. Write that down. Today's homework was way too hard. We really don't get step 3. We don't know what step 3 is. And really help them be their eyes and ears to the best of your ability. And I also think that understanding where frustration is, when frustration and stress hit a certain level, learning does not happen. Take a break, step away, have a snack, ask for help, do a lot of things, but you don't want to turn your learning space at home into something that's kind of this tinderbox where no one's learning and no one feels good, and it just feeds into that emotionality. We really want to allow kids to take a break. And set up a nice learning place if you can do it. And have that routine. So is there a table or a desk or a coffee table, whatever that space is, if they can have some ownership over that space, have their materials on that space, and really make sure that part is just set up. So they don't have to reinvent the wheel every day when they go in to do that virtual learning. It's set for them.
This information is very helpful for me as a pediatrician, because a lot of my parents come in and they're like, I just don't know what's going to happen, when the kids go back to school. So now I can safely assure them that there are plans in place to make sure that children who have special needs or academic issues are going to be addressed accordingly.
And also for the parents, I just need you to know that you are not the teacher. And I agree with Ms. Dougherty, you are not their teacher, you are their support. And so if they can't do something, the teacher won't know that if you do it. So you have to set a note, and we do this even when they're in school. Don't do their homework, send a note and say it was too hard or whatever. But I don't expect any of my parents to be the teacher. You're the support, you're the coach, you're to make sure they got their learning spot, you make sure they get up in the morning, you make sure they get dressed like they're going to school, they're just not going out the door. So you find that learning corner, and that's where they are. When it's over, they come to lunch, you give them lunch, and they go back. That's what you are supposed to be as a parent, not their teacher. And I don't want any parents to think, and I hear that a lot across the city where people say, well, I'm teaching my child, I don't know what to do. You should not be the teacher.
Thank you. I just want to say, as a parent, it is exhausting attempting to be a teacher. So thank you for freeing me of that title. I do not want to be the teacher anymore.
A whole word. Thank you.
May I make a quick suggestion?
Sure.
For break, I find that music is an excellent way to get them up and moving and to have a break from their schoolwork. So add music to that day frequently.
That's a good point. As we talk about, and we kind of went into it a little bit, when I want to dig deeper into what signs to look for as we will be spending more time with our children, what signs to look for to notice if there is a sort of a mental health decline. And Jeff, if you could start, because you see the drug and alcohol population, if you could give some tips on if we previously identified our children in that area, what support we can give, or if our children weren't previously diagnosed or seen in that area, what are the signs for us to notice if they are going down that path?
Absolutely. Thank you, LaJewel. In working with adolescents mostly and families over the course of the last 6 months who have been home with the pandemic, you see all different ways that children are adjusting in maladaptive ways to this process. Substance abuse certainly one of them. Loss of structure, these have been mentioned tonight already. Not following through with expectations at home. Dealing with the parents who are also home, everybody's stuck in the same place. Signs to look for have to do with withdrawing, changing behaviors, of course. Obviously, they're not getting to socialize. This is of critical importance in this period of their lives. So they're feeling that sense of loss, and we'll look to connect in many ways possible, virtually, etc., through video games. One of the things that has been effective in working with some of the students and families has been to look to recapture some of the structure that needs to be in place for success to occur, and or even just stability to occur. And the adolescent and child needs to be a part of that development process. I really look to empower the students that I work with to take ownership, to be accountable. I look at, parents typically fall into the role of additional control when there is a crisis or when they feel things are slipping away. And what I look to do is have the student elevate to some degree and identify how this process would work better for them. If this is the goal, what would work best for you to approach this in terms of what times of day would you prefer to work virtually? What type of sleep schedule within reason would work best for you? And to have the parents take a more of a role of stepping back and seeing if we can fit into the bigger picture than attempt to micromanage and attempt to control excessively. This will tend to generally elevate the tensions, and in a situation that's already combustible, it just kind of leads to further breakdown.
Anyone also can add for, again, to take a deeper dive into what to notice if there is a decline in their physical health or their mental health.
I would like to suggest that you pay attention to whether or not there's more arguing than usual. There may be things like nail biting. There could be things such as constant diarrhea, more TV, television, or playing with their video games when they're upset or depressed, and the withdrawal, of course, those games and what have you. There may also be nightmares, difficulty going to sleep, staying, waking up in the middle of the night. There
Dr. Good, you went out.
Oh,
you went out for a second there.
Overeating, undereating, eating more junk, being irritable and rude and disrespectful. These are signs that somebody is not feeling as healthy as they should be.
Some of my adolescent patients are actually asking for help. I've actually had young people come in and say, I think I have a mental health problem. I think I need help. I'm anxious, I'm depressed, I'm anxious and depressed. I'm fortunate that I work in one of the community health centers and we have an integrated care model. So I have 3 Masters of Social Work counselors who are right in my building. And so I have the option of walking that young person right down the hall to meet one of our counselors that day, which is really pretty wonderful. Not everyone has that luxury, but at least I'm seeing young people face to face now, and I'm able to connect them with a face that they can begin to trust. Some of our behavioral health providers have been doing telehealth primarily, And that's been sort of a mixed experience. I wonder if others here have been involved with doing telehealth visits for behavioral health.
Jeff, you wanted to say anything about your telehealth visits?
We've been operating in telehealth for 6 months, and it's been very effective in a lot of ways. I think it's going to be one of the lasting elements of the pandemic, is that we're going to be continuing to have telehealth as a large part of our counseling agency, and that's just simply a matter of convenience first and foremost. So many cancellations that we've had due to transportation issues, and we work in the Lehigh Valley, and public transit is not always as effective as it could be, and it's kind of a spread out area. So it's been very advantageous to have that format. The insurance companies had all approved it almost immediately back in March. So it's been great. You do lose a little bit, I think, in terms of sitting in person. But I think also that it's provided a way for therapy to continue. And most of the cases I've worked with are, there's definitely a need. So we're very thankful for
it. To your point, it is a huge need for it, because as a you can identify so many children that need the help, but then actually getting them to the location to get the actual help. So the telehealth is huge for my patient population. And I'm sure for several other physicians, it's key during the pandemic. And as you said, I'm praying that it stays after the pandemic.
I'm
sorry.
I do want to say that children do trust their teachers and people at school as well. And so what I've also asked my staff to look into the screens and see if you see anything different. But as parents, if you can reach to some schools do have services. We have 5 social workers assigned to our schools, so that if you see something and you can't reach your pediatrician, or if something you have a concern, reach to the school. That is a safe place for children. And most schools are safe places that the children will trust certain people that they can talk to as well.
For the School District of Philadelphia, we have, this year is the first year that we have a behavioral health provider assigned to each school. And so that will make a huge difference in that the question of connection of who or where decreases. We still have to make the connection and identification, right, virtually. But for the first time, at least each school is beginning to build a relationship with a provider that will be able to provide services in their building when we're back in person. And right now we're working through what that looks like in a virtual setting.
I just also wanted to add, I didn't want us to forget that while certainly we have to talk about the mental health of the students and their physical health, is not to forget how many parents are dealing with a lot of stress and a lot of changes in how they're feeling physically and mentally with all of what's going on. We can't forget that for some families, this time of quarantine has been a blessing, and they've had a lot of great family memories and increased family time and activities at home, but that hasn't been the case for all families. And so parents are under a tremendous amount of stress, trying to occupy their children and keep them healthy and safe and happy, and also trying to work from home. And some parents have lost jobs. And so there's a lot of stress that parents are dealing with that obviously impacts the children at home as well. And so that's something that we need to be able to address in terms of a family system. What supports can we help parents find for themselves as they're continuing to work through the effects of this pandemic? Even if they are, sending their kids to school, or if they're not, if they're keeping them at home for school, a lot of questions come up in terms of how do I know what other children have been exposed to throughout this time, or what other parents have been doing? Am I being cautious enough with my children, or am I being too cautious? So I've had a lot of parents ask a lot of questions in terms of not knowing, how to move forward through this, and dealing with very difficult decisions regarding how much risk taking is okay, what's high, what's medium, what's low risk in terms of levels of activity, and allowing their children to be children while still keeping them safe. So a lot of parents are dealing with some of these same issues that the children are, for sure.
And thank you, Dr. Kemp. I want to give a resource. In the spring, because of that, we came up with a partnership with the Uplift Center for Grieving Children, and we developed the Philly Hope Line. And it's a helpline that students, parents, grandparents can call to receive counseling services and also referral supports. So they help connect our parents, they help connect our kids, they help listen to our kids and listen to our parents. So the phone number, which I'm going to say, but I'll also put in the chat, is 1-833-PHL-HOPE, H-O-P, which is 1-833-745-4673, and I'll put that in the chat.
I wanted to add one more place that we should really be keeping an eye on our kids, and really be thinking about social media and their phone and texting. When kids are at school, a lot of the interactions that they have when they're at home and they're not on that phone, the dialogue is visible. And if it is healthy, that is visible. If it is unhealthy, it is visible. If you're not seeing what's happening, whether it's social media or in chats or in text, they may be struggling with friendships that have become unhealthy, and really adding an extra layer and not sure how to talk about it. So a healthy dose of spying, I think, is super important, and allowing your children and making sure that they know that you have access to see what's going on there, and that you care and want to know what is going on there. And that if they need support, you're there to provide that layer of support. They don't have to deal with difficulties there on their own.
I think that's really important, because part of initially, in March and April, maintaining my mental health as a parent was kind of kicking back a little bit and letting them have a little bit of their personal time. But I think a lot of us have to get back on it and start monitoring their awake hours more. Another thing that I did, which I want to start asking you guys about, for my own sanity, like I said, was just kind of letting them go. And that included him watching TV and not really having a bedtime. So if you guys could elaborate on the importance of sleep and how we can support better sleeping habits for our children as we start the school year again.
So to your point, LaJewel, we all were trying to figure out how to deal with this acute change in everyone's lives, from top up to top down. All of a sudden, everyone was home and trying to figure out how we're going to work from home. And as you said, trying to make sure the kids are getting their assignments done. And, my son popping up at 11 o'clock saying, I'm done. Can I go play video games? And trying to figure out how to manage his day. And then as you realize, as you're trying to focus on getting your work done, they've kind of disappeared and they're doing all their things. But you need time to decompress too. Because if you keep running, you're going to be angry, you're going to be anxious, you're going to be exhausted, it's just going to pile and pile and pile. And then you realize you're yelling at the kids, you're yelling at your significant other, and everyone wants to know what's going on because you're overwhelmed. Mm-hmm. So we have to figure out how to find time in our day, but then also too, trying to put some limits on the kids. And it's hard to figure it all out at one time. So, just figuring out what works best for your home. So if you have to put restrictions on their phones at a certain time, we went from COVID during the school year to COVID in the middle of the summer. And in my experience, most kids during the summertime, their schedules are off anyway. So now is the time as we get ready to go back to school, as I tell all of my patients, okay, about 2 weeks before school start, you need to really try to get them back onto a normal schedule. As far as their sleep is concerned. No more going to bed at 1, 2 o'clock in the morning, waking up 11 o'clock in the morning. And then just trying your best to get back on the schedule as much as you can, but also finding time for yourself.
If I may, one of the things that I advise both my children as well as my adult clients is to set up a routine. And that means doing things such as your homework must be done by this time, trying to get a meal in at this time, but then get your baths in, do some reading together as a family or individually, and either listen to some relaxing music or at least do a family story time before you go to bed. And I always, you know, for my children, it was a song right after the book was read. And they knew that that triggered for them, it's time to go to sleep. And you're absolutely right. Turn off the TV and turn off those cell phones and computers and reward them. Use those as rewards for following those guidelines.
Absolutely.
I don't think we can do anything that would stress the need for routine enough as a group right now. It was okay to let go during the summer, but we really do need those structures, and the children feel comforted by those structures. For the littlest ones, sometimes just looking at the clock can be helpful in having the idea that, okay, I've completed that, and now I have 10 minutes to do something else. Sometimes just packeting activities in a small way can be helpful for the youngest children. They can sort of face something for 15 minutes that they couldn't face for 50. This is not a helpful comment, but I do want to say that I dearly miss the libraries. And I think that they were a wonderful resource for many families. And I hope that perhaps we can find something in our children's lives that could take a little bit of the place of the library or be a virtual library.
I also like to offer, I'm a parent too. I have a 13-year-old and a 7-year-old. And one of the things that I think as parents we have to do is give ourselves a little bit more grace and less grief. Yes, it's important to have a routine, but also as a parent, knowing that that routine is going to look very different, and don't be so hard on yourself. I was super ambitious when we closed in March, named my school, Brown Academy, thought I was really, we're going to do this together. And by day 3, I had to sit down and have a self-reflection moment. It was like, this is not what this is going to look like. We're not going to be sticking to this schedule. And I had to say to my kids, we got to be a little bit more flexible. And so I just say to parents, yes, have a routine, but also understand that that routine is going to look different, and give yourself a little bit more grace, and don't be so hard on yourself. To the point that you made earlier, we're not the teachers.
I just want to add to what she said. You also need a routine for yourself, and you need to be able to step away. And if it means 1 hour, you do what you want to do, and 1 hour I'm going to do what I want to do. But you must take care of yourself first, parents. It's self-care, because if something happens to you or you lose it, then what's going to be happening to your baby? So make sure with all the routines of the kids, I always try to say, what about the adults? And also recognize that all of my teachers, for the most part in the school, are parents too. And so they're not only juggling your child, but their own child who's running around. So I have several teachers that are going to be doing teaching from the classroom, because they can't do it at home with the family. So if you can find a place for you as well, that is a timeout, I'll say it, a timeout for you, that's really important as well for your own mental health.
Thank you for that.
Hard.
That's amazing dedication to leave your home and go into the classroom to make sure you're able to teach the children. Thank you for that. So here's a question more about the physical health of the child, and it relates to the quarantine and if the need arises. If your child is diagnosed with the coronavirus, how do you, inside your own home, treat that child? How do you quarantine your child? How do you keep the rest of your family safe while maintaining a peaceful psychological environment around it? Dr. McDonald, okay.
I was going to say, oh, go ahead.
As a pediatrician, we get that question all the time. So, you know, if your child is positive, of course, we're always going to say that person now needs to be isolated into, you know, their room. And that may be difficult if they share a room with another sibling, right? We have to consider all of these things. But you're going to try your best to take care of your child to the best of your ability. Okay, so we always say we don't want physical isolation to end up being mental isolation. So even if, you know, the child is in their room, even if you plan to talk to them, you know, from the hallway just to kind of engage them. But once one person in the home is infected, it has tested positive, then everyone's going to be told to quarantine anyway. So everyone's going to be at home. And you're just going to try to figure out how to take care of that person who is actually positive, with keep an appropriate distance. But at the end of the day, you're all in the same home. You know, you may have that particular child put on a mask at that particular time if they're going to come out the room. You know, some families still share bathrooms and things of that nature. So while you want to try your best to keep your child, you know, if they have to be physically isolated, you do not want to socially isolate them or mentally isolate them. So you have to do everything in your power to engage the child. You know, even if you know they're playing games from, you know, they're in their room and the kids are in the hallway, you know, playing games with them. You have to figure out a creative way to engage your child, trying to get them through this process. And if I just may say, most children who get it, the disease process is going to be pretty mild, but you know, there's a small subset of children who get really sick, but most children will have a mild disease process, so they won't be super sick, but they still have it. So you have to, you know, treat them as so.
A creative strategy might be, if you don't have space where you can have your own private room, is to create a tent and play a game like you've gone on a trip and you're in your camping tent and the other children have to pass notes to you versus interacting directly. Or if you have cell phones, a lot of them all have their cell phones nowadays, let them talk through cell phones to each other, but make it fun and be creative with creating a separate space when there's not separate space. And then reward the children who help out by staying away and assigning one person a task of perhaps passing the food on and always wearing gloves when they take the plates back or the glasses back.
That's a really delightful suggestion. I love the tent idea. I also remember the joy of a refrigerator box. And I recall a couple of instances where people have made a study space out of a very large cardboard box. Or similarly, your child might study in a tent. I think that's a wonderful concept.
I think that a kiddo who's having a mild process through a positive test or as they're sick but not so sick, encourage them to continue working on schoolwork and having them busy that way. All of a sudden, when they're not able to interface personally and have that connection in their house, all of a sudden when that goes, Zoom becomes all that much more important. Being able to spend time getting stuff done, doing work, is better. You can only lay still for so many hours. And I think that those are things that just because they are not well and need to quarantine or isolate does not mean that they can't work on schoolwork. So there might be a blessing in there.
Let's stay in the vein of physical health tips. So there have been ways in which I have not been on top of my own physical health, or my children missed dentist appointments because, you know, if it's not an emergency, we're not going into the office. And certainly immunization. So what advice would you give as we start preparing for the world to open back up? What immunizations do the parents need to make sure they check up on, and what doctor's appointments should they catch up on?
I think both Dr. McDonald and I probably want to jump in on this, and I'll try to be brief, but children should have all their immunizations up to date. And the state actually made for me, distressing move, which was that kids could have delays on their immunizations at this time. I was here in 1990 when we had a measles outbreak in the city of Philadelphia and saw children die of measles. I don't want to see that again. I don't want to see a resurgence of preventable illnesses that we have been sort of on top of for generations now. So just briefly, yes, everyone get your flu vaccine and do be in touch with your pediatrician. And I think I'll leave that for now and let Dr. McDonald speak, but then we both might want to.
I agree 1,000% with Dr. White here. So what we have learned is that COVID is not going anywhere anytime soon. So we now have to learn how to live within the pandemic. So we want to continue to keep up with our routine physicals. So in pediatrics, we often call them well child checks, but the reason we're doing those well child checks are to catch small problems before they become huge problems. And we're also monitoring their physical development, their social development, their cognitive development, and also vaccines are hugely important. We do not need, Dr. White mentioned the measles. We don't want a pertussis outbreak. So we need to make sure that the children are staying on top of their routine visits. Please talk with your pediatrician to find out what changes they have made in their office in order to keep you and your child safe. So for example, you know, no one is allowed to just walk into our office. You know, when you call, we do screening tests for screening questions for COVID. And when you walk into the office, we ask you those questions again. We have signs all over the place. Anyone 2 and over must wear a mask. My staff wear masks all day and face shields. We've essentially emptied out our waiting room so that we don't have people standing around. So doctors' offices have made extreme changes to keep everyone safe when you come into the office. So please, please, please reach out to your doctors.
I would also like to remind people eating healthy is critical to staying healthy. And many times people who need the best health have the worst health because we haven't been taught healthy eating habits. Eating things that are important to you, your beans, your rice, and I say wild rice, which is very healing and protective, versus white rice. Doing things such as your collard greens, your callaloo, the foods that are healing. And that is one of the things that we frequently forget, is that most people haven't been taught what's healthy and end up eating a lot of things that have dyes and sugars and all sorts of other unhealthy ingredients that contribute to having a body that is more susceptible to becoming ill.
Thank you. We have a question that just came up in the chat. If a teacher tests positive for COVID-19 and is quarantined, can the teacher still teach remotely from home, or will the teacher be too sick? What protocols and instructions are the schools giving the teachers?
Jill, at our school, because we're in person, if a teacher is quarantined, we have it set up so that they can continue to provide instruction to the class remotely if they are well enough to do so. And then we have a monitor in the room. So we're employing substitutes because we think that teachers will be out, maybe not because they're COVID positive, but maybe they have a fever, and that fever might have nothing to do with COVID, but they cannot be in school. So to encourage that and to have as much continuity as we can, we're encouraging teachers, as long as they are well enough, to continue to provide instruction. That'll be different for different schools, and certainly teachers who are teaching remotely, if they're teaching from their home, as long as they are well enough that they're don't need to be in bed, or in that case, probably can continue to teach. And I think that continuity is really important.
Did anyone want to speak to what the Philadelphia School District is doing, the protocol for sick teachers?
You mean once we, if and when we return to the buildings? So the protocols for both students and teachers actually there's a whole reporting process which involves partnering with the health department. And so of course, folks it's the honor system that we want people to obviously tell us whether or not they have been impacted by COVID-19. And so once we are made aware, then there's a discussion with the health department, and then of course they should self-quarantine. So many of our decisions around whether or not a student, parent, or family is impacted is absolutely guided by the principals and the guidance of the health department.
I want to read this comment in the chat before I move on. Talking about feelings and how to appropriately express them is also important to do with children. Remember that their feelings matter and are valid. It is easy to get lost in a parent v. child dynamic, but I believe it's also important to make a conscious effort to check in on our children and see how they are feeling. Even when disciplining them or setting rules, being mindful of their reception of what is said is important. That is certainly important, especially while we're trying to figure out how healthy they are. And that's a part of us giving full attention to our children during this time.
And I'll add to that, one of the things that I'm appreciative of, so once school starts back in this virtual world for our students, is that the first week will involve conversations around wellness and what our students are feeling with all of the multiple pandemics that we are experiencing right now throughout this country. So I'm super appreciative of that, because those are check-in moments where, this is not business as usual. We can't just dive into the academic immediately because we can't ignore what's happening around us. So that's one of the things that the district is doing, which I think which I'm really appreciative of as a parent.
And we've even gone further to say it's not just students, it's also the adults. So we have strands that we are focusing on, and one is adult wellness, because our teachers can't help our students if they're not helped, right? And so we've pulled together programming for our teachers, as well as Honey was referencing, supports for our students throughout the first couple of weeks, where there's intense focus on relationships, connections, and really making the environment as supportive as possible.
And we have families that are grieving. Within my own workplace, we've had several families who've had losses of loved ones and have not really been able to come together to grieve over that. I keep talking about my 3-year-old granddaughter. We did not have a human loss, but we happened to have a couple of pets who died during this time interval. So it's been interesting to see her sort of try to work through the concept of death and the concept that people and animals are not easily replaced. When I start to have this dialogue with patients in my office, it is actually surprising to hear how much grief these children are encountering in their extended families, and how sort of at sea they are as to what you can do with this. They can't grab onto another person's hand. They may have had to do a Zoom interaction with their loved one.
I think that's where air hugs and air kisses, when you can't touch each other, become important. And remembering that even though many times we see more acting out because of the trauma, because of their losses, because of their parents' irritability with what's going on that they can't control, that is an opportunity to sit and talk over a meal, or right before bedtime, or when they get up, and find out how they're feeling, what they're thinking about, and sharing your own feelings, which sometimes is even more difficult for adults to do. So certainly this is a time to express more love, more concern, and give those air hugs and air kisses, and praise the children and also praise the adults for the things that they're doing, and thank them for all the things they do, including whether it's just, being there.
That's a really good conclusive statement, Dr. Gooden. And I would like to invite everyone to give one last tip or one final statement to comfort us parents as we move forward. I'll call on you, Jill.
So I think that what I try and encourage all of our families, and what we really try and practice at home, is making sure that first that we are ready to learn, that we feel good, we feel safe, we feel connected, and then learning. And when it becomes frustrating, take a break, give yourself a break, give your kids a break, give those teachers who are working so hard a break, and just be honest when you need it, because this will not be forever. And if we do this from a place of grace and a place of really allowing ourselves to make mistakes and repair those mistakes, we'll all be a whole lot happier when that time does come.
Thank you. Dr. McDonald?
I think we all want to recognize that just as the adults are going through this, the children are going through this, the children are very resilient. However, this is very stressful for them, and just take one day at a time, try to keep as much structure as possible. But remember, things may frequently go off the rails, and that's okay. Just get back on track and go forward every day. But we need our adults to be 100% to take care of our children. So we need you to take care of yourselves, recognize when things are not going well with you, and then you can also be the best advocate and caretaker for your child.
Perfect. Thank you. Dr. White? You're on mute.
Sorry, I reversed myself there. The old Dr. Spock manual, which some of us from the 50s and 60s grew up with, its legendary opening was, "You know more than you think you do." And so do trust yourself and be gentle to yourself. And if you can find something to laugh about every day, you're probably going to be helping your entire family's life.
If I can also add something, LaJewel. Can I add to that?
Please.
Okay. So just wanted to state that in terms of our students, if we are recognizing that they need additional supports for, handling anxiety or depression or anything like that, a lot of school districts do have in-house supports that they're still able to provide, even if they are virtual. I know the school district of Springfield Township, where I am, they still have the SAP program, the Student Assistance Program, where they have SAP counselors that are able to provide counseling support virtually to students in need. We also have we have several district school social workers that can help families get connected to resources in their community. So that's very important. And then, also with our students that have disabilities, such as autism or other types of learning differences, everybody mentioned routine, that's extremely important, but also helping to prepare our students for change as much as possible. Because as we know, things are changing day by day, week by week, and that may impact your routine that you spent all this time creating. So also preparing them for change, helping them develop their coping skills and their ability to kind of express themselves. And not forgetting to ask your school how their services are going to be implemented during the virtual learning time.
Thank you. Dr. Booker? You're still on mute. Here we go.
I have to agree with Dr. Kemp on many of the things that she attested to. As far as schools are concerned, hybrid or virtual, we must make sure that our young people and our parents and our staff are being served and being safe. And so for whatever choices, and I think throughout the night we've talked about no way is the right way. It is the best way that you think is safe for your child and your family and your seniors that are living in your home as well. But just know that we're all in this really together, and I hate to use that term, but it's just about that. It is about us as a community coming together to help our children and our families weather this storm, something that has taken us to another level, along with the social injustice that's going on as well. That's another stressor that's on us. But at the same time, how are we going to live through this? We will, and we will be better if it ever happens again, because we're going to take all of the lessons so that we're not going to be caught in the crossfire, because there is no way to say not to know that it may or may not happen again for whatever reason, but we should learn from everything and be prepared for anything, and or use it to make our future better.
Perfectly stated. Thank you. Dr. Banks?
I agree with everything that everyone has said. I think someone said something about try to find some laughter or things where you can. And I stress the idea of post-traumatic growth. And so I'm going to encourage families and parents to think or try to identify maybe something that wouldn't have happened if we didn't go through this. So maybe that extra time that might be driving you crazy right now, but there's definitely days and times that extra time feels good that you wouldn't have had, or that time you got to read that book or spend time with your child that you wouldn't have had because you were ripping and racing. So just trying to find if there are any little gems that we can pull out of this, that either for you or your family.
Thank you. Jeff, you're up next.
Thank you. Yeah, I would build off of what Dr. Kemp was saying, in that as students return to school, that they should seek supports. Parents who have been going through this process for several months may have noticed changes in behaviors. Ask for help, get support, get help, rely on the student assistance programs, services at your respective schools. I manage the SAP services for Lehigh and Northampton County. We had about 450 referrals from September to March. We had about 15 from March to the end of the school year. So the need didn't evaporate. It's just we're not getting services to the students that need it. So as we open, we're not sure how services are going to be available virtually still. And we're working district by district to see how are parents able to access services through parent portals. How are they able to access services virtually that used to be done in a guidance counselor's office? So parents may need to pursue this and apply that pressure to get links to SAP. There's a very quick and easy way to get assessed and referred for immediate support.
Thank you. Hania?
I will say, number one, thank you for the opportunity to be on here, and thank you, Dr. Banks, for including me. I will say to parents, particularly our parents of School District of Philadelphia families, to make sure you go through your checklist of things that you need now for your families, for your children. And I'll put a link in the chat. We have a full checklist of things that we're just making sure that families have. So, whether it's the most important thing, make sure you're signed up for the family portal. That is so critical to the information and how we communicate things to families, especially in this digital and virtual world. Make sure your contact information is up to date. And you know what? Some parents don't know what they don't know. And so when it comes to advocating for your children, especially in this space, ask questions. There is no wrong question that you can ask, because you want the best for your children and you're entitled to expect the best for your children. And so be sure to ask questions, where accessible, start looking now what your child's school schedule are. I know our teachers just returned to school Monday, so they are reaching out to families now to let them know, what the school schedules are, making sure your child has access to the Chromebook, internet. The city also just launched PHL Connected, which is a initiative that they're doing to make sure that we're getting our most vulnerable families online so that they can be successful this school year. Please take advantage of our family and engagement community office, our FACE office, they really put out a ton of resources to really support our families and particularly our parents. And I always stress that because, like everyone has said before, if parents are not empowered, then our children don't succeed. If we are not empowered to help them, and that looks different for so many families. And when someone talked about earlier, just being privileged in a sense, like I consider myself privileged in the sense that even though I'm working virtually and my kids are going to have to be online learning, I'll figure it out. But we have a lot of families who cannot, like, it's a life and death situation. They don't know how they're going to figure it out. And so I recognize that. And someone earlier said support, I think it was you, Dr. Booker, around this is the time to be like that neighbor to support families when you can. And I think that's super critical. So, you know, again, don't have in your head about what this is supposed to look like, because none of us really know what this is going to look like and what it's going to look like when we come out on the other side of this. But we're accessible here at the district. And the last thing is tomorrow, there is a back to school drive-through drive that we're hosting. They're giving out backpacks. They're giving out over 500 sneakers, Converses. And so that'll be kind of like on a first come, first serve basis. I'll also put that link in the chat. But that starts at 9 a.m. tomorrow at Lincoln Financial Field. It's our annual back to school event. Of course, this year we had to do it via drive-through. And so I really encourage families to take advantage of that. Like, I bought my kids book bags and notebooks because even though they're going to be home and this is not normal, we're going to try to make it feel as normal as we can. And that means you will get up in the morning, you're going to put your book bag on, and you're going to go downstairs to the basement, and you're going to start learning, and you're going to give me first day of school pictures like you do every year.
Perfect, perfect. I'm going to replicate that. Dr. Gooden, I started with you, and you kind of gave a really good statement already, but I certainly want to still keep the opportunity open if you had anything else you wanted to add.
Of course. Yes, I would like to say to parents, first of all, it takes a great deal of strength and courage to ask for help. And when you have the courage to ask for help, you teach your children that it takes courage to ask for help, so they learn from you. And the more you love on them, the more they can love on themselves. So remind them how brilliant they are, how beautiful they are, how talented they are. And anytime they struggle, tell them that the next time it will be easier. Just like when you play basketball, it takes practice. And perfect practice makes perfect behavior. So love on them, remind them how important it is. And if you don't have space to yourself, rotate that one room and assign a time so everybody has a little privacy at least once every day. Love yourselves. You deserve it.
Thank you. Thank you for that. And thank you for you all. This has been very filling. I, as a parent, feel very hopeful about the school year. Just to sum it up, there are great resources. You guys have just given us great tips on how to move forward. And like I said, at the very least, I'm hopeful, and that feels good. So thank you all. I'm going to turn it over now to our Executive Director, Asher Kemp.
Good evening. Just a heartfelt thank you again for your volunteerism to come together for this. As I'm listening, I'm sitting here writing notes and also looking at some of the things that I'm glad to hear that I'm doing the right things. So Dr. Goodman, you talked about music. My 4-year-old, people ask, like, how does he know all these old school songs and things of that nature? So one of his favorite songs is Fat Boys. So it's just to see him do the beatbox and just jump around. So we have a good time. So I'm just glad to hear some of these things because these are definitely unprecedented times. So you're just trying to do your best. And I'm also, you know, thankful that you guys have said, in a sense, it is okay if you're not doing things on schedule all the time. So that does happen, and, you know, allowing that flexibility because we are all human in this process. Before we close out, one of the things I like to talk about is our tagline here at the Coalition. And one of the things that we had decided as a coalition, just because this pandemic is upon us, that we are still going to do everything we can to reach people, to be vigilant, to give them resources, to talk about things. So our tagline has been this, and let me just read it for you. It says, "We will not allow COVID-19 to decide tomorrow's future, but we must really truly work together to have the best outcome for everyone." So when you think about tonight, this is what tonight was. All of us coming together to have the best outcome for everyone, regardless to what school you go to, where you're located in Pennsylvania, but to work together to have the #1 outcome for everyone. So I want to thank you guys for coming out tonight and being a part of this, and also thank our audience for letting us be in your living room tonight, or your kitchen, or your basement, or wherever you are in your house or in your car. So thank you. So we're going to close out. I'm going to ask the panelists if you could hold on for a second before we close out. So we're going to take a couple of seconds to pause. Thank you all.
Just really quick, there will be a survey when people log off. If they can complete that, that would be excellent. Thank you.